Thank you so much for having me. As he said, my name is Brianne Doura-Schawohl. I've been doing this for a hot minute. I've been in the problem gambling space since 2013 when the DSM-5 finally defined the addiction the way we're going to talk about it here today. Until then, it was often considered to be an impulse control disorder. If you have a problem with gambling, that's on you. Just stop. But that's not simply the case. We know that gambling has massive implications on the brain, and it is a disease that is very real, and it's harming individuals, families, communities. And I want to talk a little bit about some of the trends that we're seeing pop up across the U.S. As it relates to gambling policy, and what are health experts guiding us to understand, and what can we do? So you might think this is kind of funny. It's an ad for toilet paper, actually, but the gamblification of everything in society is very real, and it comes with real-world consequences. Once upon a time, we talked about gambling by getting in your car and going to a casino, and when you ran out of that cash, the night was over, and you went home. But now this is your casino, right? I was just in Richmond. I've pretty much been there every day for the last month fighting online casino gaming, similar to what we experienced here last year. Same players, same attempts. And one member said on the dais, you don't even have to put on pants to go and gamble, right? That's what we're talking about. There's a really startling fact that when you live within 10 miles of a casino, you're at a 90% chance of developing a gambling problem. So as I like to say, what happens when we turn every phone and every home and every computer into a casino? What does that mean for public health? So I figure before we start into the granular, I always find it helpful to do with some base setting. The federal government right now does not recognize gambling addiction the way it talks about other addictions. It means that we don't really have good data about what's happening. Some states have invested in prevalence studies. Others, if you don't ask the question, you don't get an answer you don't want, right? But by and large, we like to say that about 9 million Americans are struggling with a gambling problem. Now, a few things about that. For every one individual that suffers, it negatively impacts 6 other individuals. So 1, those numbers are probably very conservative. And 2, they don't represent all the other individuals that are harmed when someone is experiencing gambling-related harm. Secondly, this annual social costs about $14 billion. Again, we can't really aggregate it if we don't know how much it is impacting our communities and at what rates. But nonetheless, the federal government has chosen to not recognize this public health issue for what it is and to invest in researching, preventing, and treating it. That leaves all the responsibility up to you as a state. And that infrastructure is not so great. We'll talk about that in a minute. Some other base setting here, 5.5% of women and 11.9%. So we talk about this public health issue that it often disproportionately impacts men at about twice the rate. You may have seen some recent headlines about that. You know, betting on young boys and men. Men are absolutely taking the biggest hit when we talk about this public health issue. Also not fun facts. An individual who's struggling with gambling-related harm will go more than a decade before they will come forward and say, I need help. Why? Of all the addictions, gambling-related harm carries with it the highest rates of shame and stigma. So someone would rather struggle in silence than say, I need help. And in that meantime, they also will develop other comorbidities, mental health issues, maybe substance misuse issues. And then, why are our rates what they are? Well, an individual who has a gambling problem is 15 times more likely to die by suicide than the general population. So I like to say I'm in the business of saving lives, because that's what we're talking about here. There are real economic costs to Les's presentation, but there's also a real human cost that we need to be talking about by neglecting this public health issue. So there's Ohio. You guys aren't too bad. I mean, sometimes I'm talking to states that aren't even on the chart. But look, the truth of the matter is there's only $134 million invested across the entire United States to this public health issue. Yes, ma'am. Yeah, that is 337 times less funded than the least funded other addiction. Yet we're only 7 times less prevalent. So this is woefully misunderstood and woefully underfunded. Now, a lot of the time that I spend going from country to country or state capital to state capital, I'm talking about iGaming these days, right? We've got 40 US states that now have sports betting. So what's the next thing? That casino in your pocket. We're going to talk a little bit about that, but I like to say that sports betting was kind of the Trojan horse for the more profitable, more addictive product that they want to bring into our homes. I was very curious to understand some of the economics and the public health implications. The iGaming is illegal in 42 US states. This isn't something that's happening everywhere. It's illegal in 42 US states. But New Jersey was one of the first states to have it. They got it in 2013. So I like to look to New Jersey to understand what this would mean for Virginia or Ohio if this came into our homes. And we extrapolated out some really interesting data points around the economics of it. We'll talk about the public health in a minute. $350 million a year in taxpayer money needs to go to address the social harms that come from that product alone. That number doubles when you take into account the harm from their casino gambling, their lottery gambling, and others. What are these social costs? Crime, bankruptcy. What if I told you domestic violence rates more than double? Child neglect, off the charts. All drains on the system because we are not addressing the harms that come from the products we welcome into our state. Now, once upon a time, when I was fighting sports betting, we would hear from policymakers, but my constituents want it. I imagine you all may have gotten those calls, right? People are saying, I saw the Supreme Court said we can sports bet now, that's going to come to Ohio too, right? People wanted it. And whether we agreed or disagreed, it's here. But I can say that there's a lot of buyer's remorse that's happening. Your own governor came out saying of all of the decisions he's made, this is his biggest mistake. The senator in Massachusetts also apologized on the stand, saying, I'm sorry I voted for this. And also the consumers that once thought they wanted it, now are like, what did we do? Look at this, you guys. Only 8% of Americans say that this is a good thing for society. But now what do? We can't make it go away. In fact, actually, it's the sports betting operators who want a little bit more now. They want the next great thing. So here's that Pew Research. Sorry, I wish I could see the computer. Forgive me for looking up. 43% say it's a bad thing for society. These numbers are shocking, and we're not even 10 years post-PAFSA. We're only 8 years in. And look, it's a very small percentage of individuals that are really carrying the brunt of the social and negative outcomes. We're finding it's young men in certain minority communities. Also, members who serve our country. I am the proud military spouse, 20 years and counting next month. Military members and their dependents are 3.5 times more likely to develop a gambling problem. Why? Because of the unique pressures that certain members of these communities face. Gambling is presented as an escape, as hope, an opportunity. And let me tell you, by design, the dopamine hits. What do our members of the military want to do? They strive to win and to serve and to do it at all costs. What makes you a really great athlete or military service member makes you a horrible gambler. But that dopamine rush does not discern between the two. So also, we're not loving to see where the data is going on who's being harmed. So when I was here trying to raise the alarm bells about iGaming, I thought it was worthwhile to take a moment to talk about just the game design, how these features work and what that means for engagement and mechanics. One of the things that I find most folks are really shocked about is, what if I told you that there is a slot machine that they can offer? It's $75,000 a spin. I don't know about you, but $75,000 is what some individuals earn in an entire year, in 1 second. And what if I told you that they're pushing it in states that have this with a credit card? That is what we're seeing. That's the type of product I'm telling you they want to bring here and to your neighboring states that we're actively fighting right now. In fact, I believe we've got 8 states right now that are talking about these products. And the headlines are telling a very different story than what the lobbyists are promising, right? Promises of revenue and billions. I mean, you're talking to the lady who had to get on the stand and convince legislators that the $5 billion they're telling you you're going to get is not really going to happen, and is going to come at an extreme cost. Psychiatrist, a woman who was trained to treat addiction in Pennsylvania, found herself addicted to these products. What if I told you that a part of that was by design, that the VIP host texted her over 100 times a day? And then when she said, "I can't pay my mortgage," the response, "Here's $250 free dollars. Let's see if we can get you your mortgage money." This is their proposal. This is the business they conduct. A little bit more about New Jersey. 6% of their population has a gambling problem. That's 3 times the national average. That's why it's costing the state $350 million annually in social costs. The proportion of online-only gamblers has tripled. Why? Because that's how the gambling industry wants you to gamble now. No need to get up, get in your car. I was once told that gambling was for entertainment. It was supposed to be about socialization. It was going out to dinner, maybe dancing, and then gambling. This is iGaming. I call it isolation gambling. One of the very pillars when we try to assess if someone has a problem is, are you doing this in isolation? Are you lying about this? Are you hiding it? And yet the entire business model is to get you to gamble more and in isolation. I want to talk very briefly about Connecticut and Pennsylvania, 2 states that have iGaming. We learned some really shocking facts in pretty short time in Connecticut, that 71% of the revenues are coming from 7% of the population, 1.8% of them having an addiction, 4.9% of them being at risk. That means that 71% of the revenue is coming from people who are being harmed. It's a flawed business model. The reason they don't want to be regulated more is not to chase people into the black market. It's because if they get regulated more or restricted, their business loses out. And we're starting to understand that the longer these businesses are around. Pennsylvania recently passed a bipartisan, unanimous resolution to go and study the social and economic implications of iGaming. They've only had it for a couple of years. And the concern is so great that parties aside said, we have got to do something. That report is forthcoming. I'm sorry, it's very small, but there is a UPenn study that just came out this week. Forgive me, I've been fighting in Richmond. I've not been able to read the whole thing yet, but I can tell you that this first page tells me everything I needed to know. The people who are participating online only are more than 3 times the rate of those who are gambling in a casino. And if you have someone who's gambling in multiple avenues, that rate goes up to over 12%. Some of the most dangerous forms are mixed modality. And so this is having some serious negative outcomes for our public health. I'll leave you with this. These are not my personal views. I mean, they are now. This is based on a litany of evidence that continues to come to the forefront of attention from leading medical organizations, mental health groups, Journal of American Medicine, American Psychiatric Association, Public Health, Harvard. These products are 10 times more addictive. The Lancet Public Health Journal, the World Health Organization. The mounting evidence is very clear. What we have started to allow into our homes and on our phones is having massive implications on the people that we told would be protected. This would be regulated. This would be taxed. We could assure you that we could keep kids off. Well, here in Ohio, 620 children were allowed to gamble $2.78 million. It's on the front page of USA Today last week. If you haven't read it, I highly suggest. The systems don't work. The system is flawed. The business model is broken. It's been an absolute pleasure to be here with you this evening. I'm going to put my information up. Oops. I'm happy to answer any and all questions later. Thank you.